Hello, welcome. Let's talk a little bit about soap notes. Hope that you can hear me. Let me share my screen. Don't start. Ooh, okay, that was a good one. Hopefully you can see this. So you have another soap note due this week. So let's talk about it. Just a few slides. Let's talk about soap notes. What is a soap note? It's a structured way to talk about the patient, to describe the patient, whether you're in Alabama, whether you're in Pennsylvania, whether you're in Australia. This is a certain structured way that we can talk about what's going on with our patients. SOAP stands for subjective, objective, assessment, and plan. You have a focus soap note due this week. Focus versus comprehensive. With focus, so no, you're focused on a system or a few systems. There is no way you can do complete head to toe 12 system evaluations on every patient, every visit. No, that's not feasible. But yet, your focus exam should be comprehensive of your problem. For instance, if you got somebody with sinus, you should be checking ears, checking throat. You should not just be saying, "Oh, I palpated their sinuses." No, even though it's a sinus problem that's focused, your exam of that system is going to be comprehensive. So we just talk about focused versus comprehensive. So even if it's focused, just say you got somebody with abdominal pain. You're going to do all four: inspection, palpation, auscultation, percussion of that abdomen, right? Versus if it's sinuses, you may not check the abdomen at all. But if it's an abdominal problem, you're going to be comprehensive in doing that exam of the pertinent systems. Subjective is what the patient tells you. You should not be saying heart sounds good in subjective. Subjective is what the patient tells you. The chief complaint should be just a few words. Using quotation marks are good. You should always have a problem, even though they may come in and say, "Hey, I need my medications refilled." You can't write that on a soap note. The insurance company is not going to pay you. They have to have a problem. And you'll be surprised once you talk to that patient and say, "Oh, I just need a medication refill." Okay. And they might say, "Oh, that medication makes me use the bathroom all night." Boom. Chief complaint. I use the bathroom all night. So you're going to find a problem. And that's not really a problem to find a problem with your patient. The HPI is going to tell the story. You know how you do report off as an RN, LPN? Hey, this is so and so, 47-year-old black male presents with chest pain. Just started 2 days ago. Gets worse with activity. You're telling that story, and you're gonna make sure you include all the variables. So you got different ways that you can remember it. I don't even remember how I used to remember. I think we did old cards. Onset, location, quantity, quality. What makes it better? What makes it worse? How long has it been going on? Mild, moderate, severe, acute, progressive. Have you ever had this problem before? Make sure you include all of those variables in your HPI when you're describing your problem. Avoid words like up to date. Objective is what you observe, whether it's lab results, imaging studies. Objective is, you can kind of say, I can't think of one. But it is what you observe. You should not be giving patient reports unless you're saying something like patient breathing um, regular, which that's something you are observing. It's not what they're telling you. They're not saying, hey, I'm breathing regular. It's something that you are observing. Physical examination. You do not need all of these systems for all the problems. You cannot see this at all. Look it up, research it. But we used to get paid, or back in the day, we used to do these SOAP notes with all 12 systems, head to toe. You think you're doing good. Oh, I'm a good nurse practitioner. I listen to heart, lungs, stomach, pulses. It's not like that anymore. It's based on timing and it's based on medical decision making. That's a bonus for us as providers. They're not gonna want you sitting there trying to do a head to toe just for the record, just for documentation. No, does this patient need a referral? Do this patient need labs? Do this person need an X-ray? Do this person need to go to the emergency room? That's medical complexity. That's what's the difference as an RN, LPN, and nurse practitioner. As a nurse practitioner, you're making those decisions. That's very important. RN cannot make that decision. LPN cannot make the decision. That's why sometimes if you got like an RN or LPN, it's going to be a level 1 or 2 visit, which I do a whole nother Zoom on level of visits. You kind of see it with your Meditret. At level 3 and up, you're being more comprehensive as a provider. It's that medical decision making. Avoid the word normal. I always consider labs and tests. Assessment is pretty much diagnoses. Have at least 3. Be specific with your diagnoses. You should be having ICD-10 codes. Plan, what are you going to do for this patient? It's good when you justify what you're going to do with references. Have at least 3. If you have 1, you know you're supposed to have 2. So ideally, you should have at least 3. Justifying why you are doing what you're doing. Any questions? So reach out to me. You have the Zoom link if you want to schedule a time to meet. Best wishes.